24% of our residents in the nursing home were on an antipsychotic medication, and we were startled. We set a goal of being able to reduce it to 20%. And a year later, we are at 13%. Every shift, the nurse would mark and track their target behaviors. And we found as the reductions continued, each resident actually had less behaviors in their target behavior.
When we began with ATTAX, we were at 14% antipsychotic use for dementia-related behaviors. Today, last Friday, we were 0. It took a lot of thought and a lot of planning and patience, but we had to transition the whole culture of medication first versus, maybe our approach needs to be a little bit different.
We recently met our goal of reducing our antipsychotics by 10%, and it really was helpful for our residents because they got the benefit of our reducing of our antipsychotics, and we were able to work with our provider teams and our staff and family members to try and to educate them about the side effects of the use of the antipsychotics and how decreasing these would really help in the lives of our residents.
I think this has been a wonderful educational opportunity for the staff, not just the nursing staff, but the staff from all of the interdisciplinary team, that there's a better understanding now of other interventions that are possible other than medication.
Currently, I think we have reduced it by 50% in our target population, but the greater success, I think, is that through that education, it started, as a small seed here, and now it's being, it's growing throughout the facility. It's, nurses on the floor are making these recommendations, not quick to say, hey, they're having behaviors, calling physician, can we get something, That's not the first step anymore. It's become a facility-wide thing, a facility-wide change.
The best thing that worked for us was a interview metric that we developed for the nursing assistants. It placed a number that they received on their interview, and if they matched the number where we would hire, then they were a potential candidate, and if they didn't get that number, well, we didn't hire them.
We were looking at falls, and what kind of came up with falls is the overuse of alarms. So we started looking at each resident individually, obviously, and started to come up and do a lot more training with the direct care staff on the floor and the nurses to determine what was causing the fall. So root cause analysis was really being brought forward.
We also have implemented a wellness program where residents are seen 6 times a week, 2 times a day for 15 minutes. This has decreased our alarms from 30 plus down to 5.
So in our facility, we've been able to improve quality with pressure ulcers through being in the collaborative, and our staff has gotten lots of extra education, which has helped reduce the number of pressure ulcers. When we started, we had 5, and now we only have 1.
We have really seen an impact on residents, specifically with advanced directives. We've worked on that collaborative, and throughout the process, we've done PDSA cycles of improving lives throughout the process.
When families bring in a new resident, there's so many staff members. You don't know them all. You don't know who they are, what they can do. And what we decided to do is make a business card for each staff member. On the front, it has the facility logo, their name, and title. On the back, it says, I am a nursing assistant and this is what I do. I am a social worker, this is what I do.
That 100% of our admissions from the hospital needed some sort of reconciliation. So we did a work redesign, and what we did is we got our orders prior to the resident coming to us. We faxed the orders to our pharmacy.
They did a medication reconciliation for us, faxed us back their findings, so that when the resident got to us, the orders were complete and they were accurate.
We were at a point where we had 0 people on toileting programs. We now have about 8 people on toileting plans, which really helps improve their quality of life and is more dignifying for them.
We were having problems with staff stability and keeping and maintaining our staff, so we decided that we were going to change our orientation program. So once we hired our new staff, we were going to do questions on their second day of employment, on day 5, and then on day 8 to make sure that things were going. So it really made a much better communication network.
We talked about a person-centered care option, so the Rise at Will focus for the residents. We thought we could take it one step at a time, and that seemed to be something that we could really change. So rather than the CNAs walking through the halls, waking up residents, we let them sleep. They sleep until they want.
We were trying to figure out why this one woman, why she ended up in the hospital. With using the Interact tools, we were able to determine that she was a direct admit from a clinic appointment. So that Interact tool allowed us to look at the Plan, Do, Study, Act process and really determine that we really need to send a copy of the post with this particular resident and every resident that has a clinic appointment, so the physician is aware of the wishes of the resident.
I can think of a specific resident that it really affected. She was having a lot of pain, she was on an antipsychotic, and we told her that she was going to be a part of this pain monitoring and reduction of antipsychotics, and she was extremely overjoyed and honored to be a part of our group. And we did get her off of the antipsychotic, and we got her pain under control, and we really improved her quality of life.
We've had 3, 4, 5 frequent followers, so we initiated hourly monitoring to figure out what are they doing at this time. Of the 3 people that we have worked on, we have reduced our falls by 50 to about 75%.
I have a story in particular regarding a resident and the use of baby dolls. It's really reduced her falls, and she has not needed any increase in her antipsychotic medication.
We did have one lady who was admitted to our facility on risperidone, could not figure out why she was on it, and so we decided to reduce it and actually discontinue it. And now that particular lady is up walking. She walks from her room all the way to the dining room, really is doing very well without the medication.